PRP doesn't work. This is what a lot of orthopedic doctors, physical therapists, and other healthcare professionals want us to believe. But it's a lot more nuanced than does it work or does it not work. And today I want to talk about what that means. It's completely reasonable to be skeptical on new treatments and treatments that have emerging evidence, especially when we don't have high powered studies that show that these treatments are effective. Whenever we go through a process to approve a new drug in the US, there's tons and tons of research dollars that are backing the studies for those drugs. And as much as we can make fun of and hate and dislike, question the morality, etc., of pharmaceutical companies, that is one of the benefits they have, that they have tons and tons of money. They raise tons and tons of money to help their research. Now, does that make some of the research biased? Yes, it does. But that also allows them to do high powered studies to show the effectiveness of treatments. And the drugs that they put out there have to show at least better or at least the same of the standard of care for that treatment. That's what's very difficult in the regenerative medicine space. Couple of points I want to make right here. One is we don't have that same amount of research dollars that can make these very, very high powered studies. And when we say high power, we mean lots and lots of patients in the study to make it an effective study. That's kind of where we have one limitation. It's hard to design these studies as placebo-controlled, randomized controlled trials, and then developing meta-analyses of multiple random controlled studies to give us this really, really great evidence. And granted, we're kind of still in the infancy of what these regenerative medicine treatments are, whether that be platelet-rich plasma, mesenchymal stem cells, or even things that aren't FDA approved in the US, like placental-derived cells and Wharton's jelly and exosomes. So when people say, well, PRP doesn't work, they're basing it off of studies that we can't generate high enough power. Now, anecdotally, we know that some of these treatments have great healing power. And in my own clinic, I'll give an example of a 71-year-old female who had gone through the gambit of epidural steroid injections, radiofrequency ablations, and basovertebral nerve ablations, and none of this worked. None of this helped her pain. And we did a platelet-rich plasma treatment for her, lumbar spine, and she came back with 75% pain relief. And she was able to walk further. She was able to do more. She also, interestingly, told me she had less headaches, which mechanistically, I don't know why that happened, but I'm guessing just because she's probably sleeping better, she's probably able to move better, and that's kind of helping her overall systemic flow and making sure she's feeling a little bit better. So that's one of the big reasons why we are in a limitation of what our studies are capable of showing. Another big issue that we run into is how are these studies designed? Quite frequently, these are small case controlled studies, and this is really where the orthopedic surgeons that don't believe in regenerative medicine or platelet-rich plasma like to bash. But if you look at some of these studies, they are picking patients that are not good candidates, either too far gone with our osteoarthritis or not the right pathology. Quite frequently, they'll just do a basic knee injection with platelet-rich plasma instead of doing a visual guided injection, meaning using ultrasound and or fluoroscopy, which is an X-ray. And other times, they aren't hitting all the important structures that might be damaged that we see on imaging, whether that be lateral collateral ligaments, ACL, LCL, PCL, maybe the patellar tendon, maybe the quad tendon, maybe the meniscus. In a comprehensive approach, you really need to focus on all the pathology. And this is, again, kind of a problem with what our standard of care is. Because if someone comes up with knee pain, you just do a basic knee injection. Quite frequently, we're doing knee injections without image guidance, which shouldn't be standard of care, but unfortunately, visual guidance has not become standard of care quite yet. But that doesn't necessarily treat everything. And sometimes patients are just getting the benefits because they're getting an anti-inflammatory effect of a corticosteroid. Now, we also can argue at this point that corticosteroids are known to be toxic to the cartilage of joints. We have shown studies that patients that get knee injections are more likely to get a knee injection sooner than a controlled patient that did not get a knee injection with corticosteroids. And also, we have emerging evidence and new evidence that are showing that even a single steroid injection shows death to the cartilage cells in that knee. So, something just to think about, like, what are we actually doing when we're treating somebody with steroid injections? So, when you want to argue PRP doesn't work, we kind of question, well, what is our standard of care? If we're doing harm, we are literally doing harm. And we took oaths not to do harm. Yes, you feel better in the short term, but in the long term, the results are speaking for themselves. Another problem with a lot of the studies that we see is that the cells, the platelets that we derive, need to be concentrated to a high enough level, maybe 10x, maybe 14x, depending on age and pathology, to have an effective treatment. So several studies have shown that this has been the truth. And when we compare that, we get that high 10x, we'll say, platelet level versus corticosteroids, the 10x platelets actually had better long-term outcomes after a year. So we know that some of these studies are poorly designed and poorly done. To get that 10x number, sometimes you need to draw 240 cc's of blood. Now, that's a lot of blood. And most clinics that have these kits that are sold from less than reputable regenerative medicine companies only get 8, 10, maybe 30. Even 60 probably isn't enough to have an effective dose. Now, there is some theories that saying if you do a series of 3 platelet-rich plasma injections into the knee, that might be as effective. And some of those studies are going head-to-head, and we're trying to figure that out. But that's something to keep in mind is what is the platelet dosage that we're actually getting for the affected area? And is that an effective treatment dose for that area? And again, this is where the emerging evidence is coming out, and we're becoming more nuanced in, hey, we really better get that dosage. Otherwise, we don't expect a good outcome for that injection. Another big argument that we hear quite frequently is the cost for these things. Cost is interesting because everybody has a different attachment to money. Some people are willing to pay tens of thousands of dollars on new clothes, on new cars, vacations, makeup, Botox, and golf memberships, country club memberships. Now, I'm not questioning and I'm not making fun of or anything about those people. I think that's completely fine. I mean, I'm a member of a country club. I spend a lot of money there. I get it. It's part of my joy. It's part of my happiness. But if you have that kind of money to spend elsewhere, why are you not spending on the most important thing that you can, which is your health? The only thing that we have in this world is time. At the end of the day, we are all, unfortunately, going to meet our maker at some point, and time is the only thing that we have. If you really think about it, quite frequently, we work hard to buy ourselves more time. But if we don't have the time to enjoy our lives, if we don't have the time to play that golf round or go on that vacation and enjoy it because we're in pain, then again, I ask, what are we really doing? And it's a question you should ask yourself. If nothing changes 1 year from now, with your pain, what does your life look like? And it's a powerful thing. It's a powerful tool to think about. Are you willing to give up some of these feel good things, make yourself look good things, feel good dopamine wise, look good for, attention or your own self confidence, which is fine. But wouldn't you want your body to reflect that happiness? And I think that's where the power of these regenerative medicine treatments come in. Frequently, people will say, well, I just want my insurance to pay for it. And why won't insurance pay for it? Outside of life-saving surgeries, cancer drugs, some of the cardiovascular drugs, and some medications, I'm actually, even with those examples, I want to ask you another question. When has insurance company ever been on your side for anything? I know in my practice how difficult it is even to get an MRI of a lumbar spine for a patient with an acutely herniated disc. They make us jump through all types of hoops just to get the approval. Even then, you're paying hundreds, in some cases, thousands of dollars out of pocket for your deductibles, and then copays, and then your monthly premiums. That does not seem like a financially smart investment, in my opinion. What if you existed in a world where you could save those copays, save those deductibles, and pay a one-time upfront fee, or in some cases, a payment plan for a procedure that actually makes you feel better and allows you to do all the things you want to do? And hey, if you can get back to working out, run again, lift again, hike again, spend time with your family, all those things have been proven to show better long-term health outcomes. So in the long run, you're probably spending less money on your health concerns. And that's just one kind of piece of the pie. Again, I question you, think about something in the insurance world that has been beneficial for you. And I will give you the example of a few medications, life-saving medications, life-saving surgeries. I'm fine with that. But even a lot of those, your insurance companies tend to deny a lot of those expensive medications. And in some cases, it's actually much cheaper to buy those medications or pay out of pocket for those surgeries. So that's definitely one big point I want everyone to think about when they are making a decision for their own health. The other big knock on PRP and regenerative medicine therapies at this moment would probably have to be, people think it's only for the athletes or the high level people, but it's not. I gave the example earlier today of, an elderly lady, 70 is unfortunately in the elderly range now. And even though she doesn't look it and doesn't feel it, it is. But she regained the purpose of her life and was able to do a lot more. And I think that's why it's so important to get this message out there to people that, you can say PRP doesn't work, but I can also show you tons of examples of where physical therapy failed to work or surgery failed to work. Everything cannot be taken with a single case study. That's why we run bigger studies. The more people, the more we have in the pool, the better our power of the study, and the more likelihood that treatment actually works. And even if you want to say it's a placebo effect, well, some of these placebo effects are more effective than our standard of care for longer terms. So that's another argument that I would say, platelet-rich plasma, it may not work for some people, but if we take in all the factors of, did we look at this patient as a whole? What is their inflammatory status? What is their hormone status? Is their immune system shot right now? Have they been eating a healthy diet? Have they been avoiding alcohol and smoking and other nicotine products? Have they been avoiding medications like non-steroidal anti-inflammatories and corticosteroids? How have they been sleeping? How's their stress levels? All these things go into the pot of making an effective regenerative medicine treatment. And then, are we getting the platelet levels high enough? Are we treating the right pathology? Are we actually injecting what we need to inject or treat? Are we using the guidance of ultrasound or fluoroscopy? Um, are we doing it with a regenerative medicine specialist, or are we just doing it from the family practice doctor who's trying to make a few extra $100 a week by pushing this on their patients, or a non-licensed nurse practitioner who does blind injections for a chiropractor? These are all questions you need to consider and think about and ask yourself at the end of the day. So when people tell me PRP doesn't work, I could talk about this all day, every day, because I'm so passionate about it, because I'm seeing the change that's happening in my patients every day. And that's why we do what we do. And I'm looking forward to working with the leaders in this field over the next few years. I've started developing great relationships with them. I'm going to start going to a lot of the courses with them to pick their brains and get better outcomes and get better information and better training and better tips so I can get better outcomes for my own patients. And we're going to start tracking these. And we already do track these in data biologics, which really has the forefront of getting all these studies together so we can prove to the world that these therapies work. Anyway, I hope you guys found this useful, or at least got your wheels turning a little bit about what PRP is. And when people say PRP doesn't work or regenerative medicine doesn't work, makes you question, makes you think a little bit. And I'd love to help you out. If you have questions, comments, please drop them below. Feel free to reach out to me. And if you're in the Ohio area or you want to travel to Columbus, I'm happy to get a consult with you and take a look and see what we can do to help you out. All right, everyone, I hope you have a good holiday season, and I'll talk to you soon. Take care. Bye.